The most common type of surgery at the moment patients are requesting is abdominal resculpting, removal of excess fat, and sometimes we remove skin with it to restore the weakened and separated muscles and excess of skin in the lower part of the abdomen to give a patient a smoother and firmer profile. It depends. If we need to remove only fat, we're talking about a liposuction surgery as something that a patient could do in a day case procedures and a quick recover. But sometimes the abdomen that we see, they deserve a bit more job to do it. And we will talking about tummy tuck surgery. It's a more complicated surgery where a lot of other issues are involved before surgery and after surgery. More appointment, more post-operative care, and a bit longer recovery. The most common side effects after these procedures are anesthetic related. Some patients, especially if they are not used to have anesthesia, if they don't used to take painkillers, they feel a bit nausea after surgery, and they could experience nausea for more than one day, for like 3-4 days after surgery, especially because we are keeping on giving patients a painkiller. Other side effects could involve infections, and infection, unfortunately, is something we cannot avoid it, but we like to prevent it with a good wash before surgery and with antiseptic dressing after. Sometimes patients are experiencing bad wound healing, and often is due to swelling, because after this surgery the abdomen often is swollen up, and that's why we like patients to wear garment, even if often it's difficult to let them wear garment for 6 weeks after surgery. That's what we like to do it to prevent wound healing problem and long-term swelling. The ideal candidate for any plastic surgery procedure is an healthy non-smoker patient. But often, we see a range of patients. We try to prepare them to have a surgery done, and who want to have a flat and well-toned abdomen is something everybody of us are, ideally imagining for ourselves for after lockdown and after summer period, probably. The recovery is half of what kind of procedures we do it. The liposuction in the abdomen is something we do as a day case, and the patients for a few days are staying home, and they could go back to work after a week time. But to go back to exercises, we invite them to wait a minimum of 4 weeks after surgery. If a skin is removed and if some muscles surgery is done, it's better to wait 6 weeks to go back to strenuous exercises and to have a normal life. But usually patients, they go back to work after 2 to 3 weeks. It depends what kind of job they do. So suboptimal aesthetic result, unfortunately, can happen if a patient is not compliant after surgery. It's not easy to be a patient and to rest for 6 weeks, but the wound, even if appears healed, it could be stretched if a patient are overdoing after surgery. And so, unfortunately, a scar in plastic surgery is something important, and that's why to don't have a suboptimal result, we give a patient's instruction to follow. The scar could be sometimes thicker than usual if the wound gets infected after surgery, and that's why we give a patient's appointment to come back and to be checked by a personal nurse to prevent the scar get thick and hard and firm, and give a patient sometimes heaviness in the lower part of the abdomen, just due to adherence of the skin to the deep layer. But if the patients wear garment for 6 weeks and if they follow our advice, it's rare that these procedures they are having with long-term complications, side effects after the surgery. The population is usually well satisfied after these procedures.